Hi, I'm Aaron.
And I'm Bryan, and we're going to talk to you about strength training the older adult, to show you how to turn this guy into this guy. But first, a quick overview of the video. Let's talk about why it's important to train strength in older adults. We're not getting them ready to compete in bodybuilding or strongman competitions. We just want to give them the strength and confidence to perform daily tasks easily and to improve their quality of life. This video will show you how strength training the older adult helps them perform simple tasks like taking out the rubbish, moving stuff around the house, and even with simple things like walking and standing up out of a chair. But before we start training the older adult, it's important that we understand why it becomes more difficult to perform these daily tasks as we age. The first reason is due to the process known as sarcopenia. Sarcopenia is defined as a decline in muscular strength and mass as a result of aging, and it has been linked to falls and a loss of independence in some individuals. Studies have found that due to sarcopenia, the body can lose up to 24% of muscle mass between the ages of 40 and 70 years old, and then 15% every decade after that. The second factor affecting older adults' ability to perform tasks is osteoarthritis. Osteoarthritis is defined as the degeneration of joint cartilage and underlying bone. This absence of cartilage results in bones grinding against each other during movement, which causes a lot of pain and discomfort. A study by Dawson found that 40.7% of older adults experience knee or hip pain from osteoarthritis. This shows just how prevalent this issue is.
Resistance training has proved to be more beneficial for older adults in comparison to aerobic training. This has been seen through results in low intensity resistance training, which shows no link to an individual's hormonal makeup. This shows resistance training is not just for testosterone pumped teenagers. This allows individuals to train at a lower intensity, minimizing the effects of existing conditions such as sarcopenia. Physical activity is most beneficial for increasing the quality of life in older adults. Many studies have shown that certain forms of resistance training are most helpful for an older adult to perform everyday tasks efficiently. Evidence showed that resistance training at a rate of 50% 1 rep max promoted mobility, allowing individuals to perform daily tasks such as climbing stairs with ease. This intensity of training was most effective as the slower eccentric and concentric phase of movements allowed greater stimulation of myofibrillar protein synthesis, improving muscle function.
While working at moderate intensities helps with mobility and reducing sarcopenia, other intensities have other effects. Porter study shows that high-intensity resistance training in older adults leads to increased protein synthesis and muscle hypertrophy. This concludes that it helps improve the older adult's rate of recovery and has also been shown to reduce the effects of sarcopenia if performed 3 times a week over a long program. Strength training has also been shown to help with osteoarthritis. A study performed by Slamenda found that weak quadriceps are a risk factor contributing to osteoarthritis in older adults. In order to combat this, it is important for older adults to participate in a strength resistance program. Positive results were found in a clinical study conducted by TOP, which involved participants performing a lower extremity strength program 3 times a week over a 16-week period. After the program, participants reported 58% less pain in their affected joints and stated that exercise worked better than over-the-counter medication, as well as noticing an improved ability to go both up and downstairs. We've seen how strength training can minimize the effects of sarcopenia and osteoarthritis. Now we're going to look at how that translates into improving quality of life. Now, quality of life can be hard to measure. We can achieve this by measuring an individual's ability to perform activities of daily living, or ADLs. The ADLs most commonly looked at in the literature include gait, which is walking speed, chair rise time, which is the time it takes to stand up from a chair, the 8-foot up and go test, which is standing up from a chair and walking 8 feet, the stair climb, and of course, balance. Now let's look at how strength training influences the older adult's ability to perform ADLs. High velocity and power training have been found to be beneficial for older adults in improving ADLs. This requires participants to move a weight/resistance as fast as possible. Power and high velocity training has shown to be more beneficial for improving ADLs than regular strength training. study conducted by Hazel compared those training power with those traditionally training strength and found that the power training group had improved balance scores, sit and reach scores, gait speed, and chair rise time. This can be seen in Henwood's study, which found that older adults who participated in an 8-week high-velocity weight program had a 21 to 82% increase in muscle strength and a 17 to 30% increase in muscle power. This resulted in a 26% improvement in overall ADL scores. Weights aren't the only form of resistance training needed to improve strength and power. A similar study performed by Haruda used TheraBands as a form of resistance for the older adult. The study resulted in 32% quicker 8-foot up and go times and a 36% quicker 6-meter walk time.
Resistance training was proven most beneficial for older adults, increasing function and mobility at a higher rate than aerobic training. An intensity of 60% 1-rep max benefited older adults with sarcopenia by slowing the effects and increasing their overall quality of life.
Through the video, we've also shared how high-intensity resistance training improves protein synthesis and muscle hypertrophy in older adults, meaning that it helps with their recovery after physical activity, and that if it is performed regularly, it can reduce the effects of sarcopenia. We've run through TOP's 16-week lower extremity strength program that improved lower limb muscular strength, improved participants' ability to go both up and down stairs, and reduced osteoarthritis-related pain in the knee and hip. We've also covered that high velocity and power training using both weights and TheraBands improved muscular strength and power, and the older adult's ability to perform ADLs like walking, standing up from a chair, and balance. So I think it's safe to agree on the fact that there are a few different ways to train strength in the older adult, from varying intensities to changing the equipment that is used, but all of them have benefits in improving their quality of life. As long as you're training 2 to 3 times a week regularly, you're going to see benefits, whether it's in mobility, muscular strength and power, and improved ability to perform a simple task, reduced joint pain, or even just to get in shape for summer. As an older adult, strength training is just too beneficial to miss.